What is restless leg syndrome? Restless leg syndrome is a condition that causes a strong urge to move the legs. This urge to move may be accompanied by other uncomfortable sensation felt inside the legs that are difficult for children to describe. The uncomfortable sensation and urge to move are made worse by rest or lying down and are temporarily relieved by walking or moving the legs. Why does my child have restless leg syndrome? In some cases, a gene causes this problem. So, it's common for another family member to have RLS. An important chemical in the brain that helps control motion, called dopamine, may be low in children with RLS. Children with early onset RLS may show evidence of an iron deficiency in the brain. Iron is required for proper dopamine activity in the nervous system. What are some signs and symptoms of RLS? Discomfort in their legs, twitching or random uncontrollable movements, disturbed, interrupted sleep leading to irritation and fatigue. How do they test for RLS? Doctors often order a blood test to measure iron levels for patients who may have RLS. Iron deficiency can cause or worsen RLS in children and adolescents. Even when the deficiency is not severe enough to cause anemia, a ferritin level of less than 50 mcg/L, which may even be in the low normal range, indicates a potential problem. Your child's doctor will also do a physical exam and medical history to see if RLS runs in the family. Your child's doctor may also request a sleep study to check for sleep disturbances. Getting diagnosed with RLS. There are 3 types of diagnoses for restless leg syndrome. First diagnosis type is definite RLS. Your child feels an urge to move their legs that begins or worsens with sitting or lying down and is partially or totally relieved by movement. The urge is worse in the evening or night than during the day, or occurs exclusively in the evening or nighttime hours. Children describe the discomfort using their own words, such as, owies, tickle, tingle, static, bugs, want to run, a lot of energy in my legs, etc. The child is experiencing sleep disturbances. A biological parent or sibling has RLS. A sleep study has documented a periodic limb movement index of 5 or more per hour of sleep. Second type of diagnosis for RLS. Probable RLS. There is an urge to move the legs and the move begins or worsens with sitting or lying down. The urge to move is partially or totally relieved by movement. The child has a biological parent or sibling with definite RLS. Third type of diagnosis for RLS. Possible RLS. The child has a biological parent or sibling that has definite RLS. But the child does not meet the criteria for definite or probable childhood RLS. How can you treat RLS? Medications. Sleep medications that have been prescribed by your child's doctor. Good sleep habits. Getting a healthy amount of sleep. Nightly iron supplements. If your child's iron is low, taking iron supplements may help treating ADHD symptoms. If your child is diagnosed with ADHD, taking medication may help with their RLS.